Bismillahirrahmanirrahim. Thank you for the opening and good morning for everyone. Dear President and all of the committee of Perdoski, Professor and all participants of the DERM highlight meeting today. Good morning and healthy greeting to all. My name is Dr. Hanny Nilasari, is a moderator for this session. Today it is very special because we have a serial webinar from Perdoski with the title DERM Highlights Meeting. The big theme is today for the first session, the big theme is the From Surface to Shape. This is our agenda for our first session. We have two speakers and we have 1.5 hours for presentation and also 20 minutes for discussion. Please, Dr. Dian, for curriculum vitae of the two speakers. The first speaker is Dr. Danné Montague-King from USA. He is a founder and scientist at the MK Transgenesis International and also creator of the MK Foundation of Skin, the MK Skin Revision, BioFreeze, and Deep Freeze. The education in Northwestern University in Chicago. He received many awards as a Global Human Rights Ambassador by Harvey Milk Foundation and Ph.D. honorary from Bully University in London, and also the contributor in Aesthetic Journal and also the many books. Thank you. And the second is curriculum vitae from Dr. Yuliya Borzykh, Ph.D. from Ukraine. He is a Ph.D. medical science, dermatologist and cosmetologist, and instructor of the MK Ukraine in Czech Republic and Poland, expert of JIP, the MK International. She is Ukraine General Medicine Department on 2006 and 2015 Ukraine she received her PhD, and also she is a general therapist and also the dermatologist, a specialization on dermatology as cosmetology. She has been practicing dermatology for 14 years, and also she is a representative of the MK Ukraine and also the DMK educator in Ukraine, and also took part on CosmetX Congress for Aesthetic Medicine Professional in Riga in 2017 as a speaker. And also in 2017 with team of the MK Ukraine, she is a She is won 2 nomination, the Game Changer and Open Medical on the largest international competition of aesthetics and medicine and cosmetology, the Skin Games. Thank you for the curriculum vitae, and we start for the first presentation. And in this very special occasion, Dr. Danné Montague-King from USA would like to present the video about the advancement in the fields of aesthetic. Okay, to Dr. Danné Montague-King, please with your video. The time is 10 minutes.
Hello everybody. Today we're going to address the aspects of the new DMK endowment system. Now, I really didn't want to get involved in bacterial research. In fact, I have a lot of respect for scientists who are bacteriologists. And when I started actually researching probiotics, etc., for skin, I found out that I was on the tip of a very big iceberg. And it was an enormous field of science that really has not been addressed very often. As a matter of fact, when I first started the research, I attended several conferences with young scientists from all over the world who are researching the microbiome. And they all had about the same information, no conclusions on any practical use with products, but wonderful results of research on what bacteria is and what it is not. Now, like anything in our body, we have the good and the bad. And there has to be a balance. like yin-yang. There has to be a balance for it to be concentrally maintained. We call this homeostasis, all right? Let's think of the skin as a landscape, and with trees and rivers and rocks and grass and whatever. And let's say something comes along and blasts the landscape, burns everything up. We can compare that to an aggressive peel, such as pro-alpha 6 layer peel, or even the DMK-RP, or any of our other alkaline wash, etc. Okay? Now, we know that we are completely getting rid of everything. And we also know that after this kind of aggressive treatment, we are going to replace the nutrients back into the skin so it can function normally in a better way. This is part of our famous remove. But sometimes we want to be able to get the right type of bacteria to that landscape first. After it's leveled, think of it as a desert. Okay, whoever gets to the desert first rules the land. If S. epidermis, which is a good bacteria, gets there first, it rules the land, and also keeps S. aureus, the bad bacteria, in proper places where it's supposed to be. But if S. aureus gets to the landscape first, then you have chronic dermatitis, you have redness, you have inflammation, you can have all kinds of skin disorders. And there are many, many types of skin disorders that dermatologists and skin therapists are unaware of and have been misdiagnosing for many, many years. Good example, when I first started the research on the environment, we sent the products around the world to some of our top therapists to work on different patients to see what types of results would happen. And one of our very first subjects was a Chinese gentleman working in Australia, and he had great big patches of severe hyperpigmentation all over his face. And he had gone to the dermatologist, to a dermatologist, and was told, well, you have eczema. And as a result of the eczema, you have hyperpigmentation because eczema is traumatic, okay? And hyperpigmentation does rise up in any kind of trauma in the skin. And so that's what he thought he had, and nothing ever seemed to get rid of it. Now, one of the things that attracted me to the microbiome was the research that these young scientists were doing in eczema, because eczema is a very hard disorder of the skin to address. We've had pretty good success with it over the last 50 years, but still it's an ongoing process. It's very intrepid and seems to come back all the time. But with certain amounts of microbiome, it seems to be killing off the entities that create the eczema skin. So anyway, the startling thing about this was that he came into the clinic, this is in Australia, and he had the environment applied. The next day he came back and all of his hyperpigmentation was practically gone, only the tiniest little bit, as seen in this illustration. It was amazing. And so we were thinking, well, how could this happen? Turns out he had a disorder called malassezia. Malassezia is a skin fungus, and the microbiome got rid of it immediately. So there was a whole range of skin funguses that we've been unable to address all these years that are easily eradicated simply by maintaining the healthy microbiome that the skin actually needs, okay? So in order to create this, you have to start off with a prebiotic, which would be in the form of a cleanser, all right? Cleanser is designed to prepare the skin for a healthy microbiome development, all right? It also helps to regulate the skin flora through the activation of B defensin synthesis. Tongue twister, too many S's, all right? When this happens, just with the cleanser, irritation calms down, redness and inflammation that may trigger the growth of the opportunistic or the bad bacteria, all right? Now, let's say the client has acne and you want to work with them with the environment system. There are many ingredients in our acne formulas that are not suitable for this because they kill all the bacteria. So you want to take care of the acne first. We'll talk about that a little bit later before the environment. The next step would be create a mist that sets up the field, because we have a natural good bacteria and bad from birth, located behind the ears, sometimes under the nose, sometimes in the temporalis, sometimes under the mandibles, but it's there. And even in bad cases, still a little bit of it is there. So what the mist does is it pulls all the good bacteria out over the whole surface like an army, the army of the good guys, keeping the bad guys back where they belong and not ruling the land, because now S. epidermis rules the land, the good bacteria. All right. Now, once this is accomplished, then you've got to put a serum on, or an emulsion that lasts for several hours. Okay. And this is the probiotic. And it's emulsion that introduces healthy bacteria and supports their proliferation and the balance of diversity. Diversity is very, very important in any aspect of life, particularly in the skin. You can't go with just one genus of bacteria. You have to have good and bad in homeostasis, okay? So that creates the microbiome shield that not only gets rid of a lot of strange skin disorders that you never had good luck with removing before, but also keeps the patient or the client with a shield that will ward off increasing attack of bacteria that surrounds us nowadays. Now, as far as the virus goes, we don't know that yet. I have a few things that can kill the virus, including COVID. Our ultrasound is one. But I think that's going to come under this microbiome banner also. We're working on that now to see how much virus is influenced by our environment system. We know the skin fungus is certainly influenced. We know that lots of other things are influenced, but I would like to be able to add something to the viral banner, because that's going to be on everybody's mind for a long, long, long time. That's the new buzzword, is virus. Bacteria is yesterday. Virus is the future, and we have to be prepared as practitioners. So you have it in a nutshell. The environment is the world's first actual prebiotic, probiotic, and postbiotic. But there's going to be 100, 500 even, skin products that are suddenly going to hit the market, and they're going to say probiotic for skin or microbiome friendly. And I knew that in the beginning. That's what kind of forced my business partner to tell me, you've got to start working on probiotics for skin, when I didn't even want to. But I knew there'd be a lot of companies that are going to sell this stuff. Most of it is dried yogurt in a cream or a lotion, okay? Deader than a doornail. It won't work. It has to be a living spore. Absolutely has to be. And that wasn't as easy to do as I thought it would be. It was kind of hard, because not only do you have to have a living spore, but you've got to put it into an environment or encapsulate it to where it stays alive while it's in the product and on the shelf and in your home until it's applied to the skin, and then the pH of the skin and the body temperature bursts the container, and the living spore then does its work in your skin. Very hard to do, but we've managed to do it. So I think you'll find in the next few years that maintaining a healthy microbiome on the skin will lay waste to many, many little problems that we've always had trouble getting rid of before. Thank you.
Thanks, Dr. Dan, for interesting lecture. We learned about the importance of maintaining the microbiota for the skin. Thank you. And for all participants can write the question in the column Q&A. And then we move to the next speaker. The next speaker is Dr. Yuliya Borzykh, Ph.D. from Ukraine. You have 30 minutes for presentation, and to Dr. Yuliya, time is yours. please.
Thank you so much. Are you hear me?
It's
Yes,
clear,
doctor.
Dr. Yuliya. Yes.
Um, are you hear me good, yeah?
Yes.
Thank you so much. So we start. Hello, dear colleagues. I'm honored to be speaker at Indonesian Society of Dermatology and Venereology. As a dermatologist, I have been always deeply concerned about the quality of my patient's skin. Fortunately, in my profession, I managed to combine both dermatology and cosmetology. I got my degree in dermatology, and the main topic of my study was scar treatment. In our company, we are constantly implementing approaches from the surface to shape, which means the following. We start treating the skin from surface. In the other word, we improve the skin surface by increasing microcirculation, improving the lymph drainage, moving the hyperkeratosis, and so on. And only after that, we can use different injections, lasers, plastic surgery, and so on. And as you may have guessed, we are following a combined approach. I'm honored to know Danné Montague-King, the founder of cosmeceutic DMK personally. Danné is a worldwide leader in the field of skin revision, and inspired by his own severe acne, he began treating his own skin with chemistry that the human body recognizes. The incredible result Danné achieved on himself led him to research similar methods for treating other skin conditions, including aging, scarring, pigmentation, and ethic-related conditions. The slide shows that Danné Montague-King started to practice combined techniques in the early 70s, when he tested deep skin peels and aesthetic surgery. In the 2000s, he had successfully combined DMK with botulinum toxin therapy and biorevitalization in order to prevent complication and maintain the result. On the whole, this approach is getting more and more popularity, and it is in a high demand in Europe and Ukraine. We are constantly published articles about injections and cosmeceuticals as a winning tandem. This slide.
Dr. Yuliya. Hello,
Yes.
Dr. Yuliya. Is the slide is not appeared here?
I'm sorry.
Your slide?
Yes.
Yes. No.
Yeah.
No screen share.
Oh, no screen shares.
Yeah.
You didn't see anything, yes?
Yes.
Oh, I'm sorry.
We didn't see your slide.
Mm-hmm. One moment, I'm sorry.
Yes.
Now you can see, yes?
Yes. Yes. And the slideshow.
So I scroll through.
Okay, yeah. Okay. Thank you.
Okay. Combined technique that I said before, the 70s, yes, started deep peels and aesthetic surgery, and 2000s had successfully combined DMK and botulinum toxin. Is it clear? Yes?
It's clear.
Oh, thank you.
Yes, Dr. Yuliya.
So let's continue. So we constantly published articles about injections and cosmeceuticals as a winning tandem. And this slide demonstrates the importance of cosmeceutical procedures among the multiple aesthetic procedures on the market. Using efficient cosmeceuticals before and after injections allow making the skin healthier and firmer, improving its quality attributes, as well as taking the prophylactic measures and treating the complications. Proper preparation of the skin before injections, laser and plastic surgery and other manipulation will help to even out the complexion, improve the skin relief, narrow the pores, and increase the protective value of the skin and strengthen the skin barrier. The proper preparation will minimize the negative effects of invasive procedures, such as bruising and abrasions, and it will enhance the effect of injection and the reduced recovery times. Let's step back. I would like to explain our approach in treatments. As I mentioned before, we always start with the surface, and only then we attempt to go deeper into the lower layers. So what does it mean to work with the surface? I'm not afraid to repeat myself that it means to restore the skin barrier functions, improve metabolic processes, refine microcirculations, and lymph drainage, of course, to mention the more prominent. As you know, it is important to have a strong skin barrier, or to be more precisely, the skin barrier function, as is essentially the outermost layer of the skin, plus the lipid matrix composed of ceramides, cholesterols, and fatty acids that holds those cells together. One may ask, why is maintaining a healthy skin barrier important? Maintenance of the skin barrier is essential for survival, to keep water in and other stuff out. Skin barrier is what stands between us and the outside world, like a brick wall surrounded a property. Its primary role is to prevent excess water loss, keeping us well hydrated in case this barrier is dysfunctional. Well, the result can be devastating for the patient with skin health. We can help to repair our skin's barrier by professional treatments and adequate home prescriptions, using products with a suitable pH, and using a moisturizer that contains ceramides or humectant like hyaluronic acid, ingredients that help us with skin barrier restoration, such as ceramides, free fatty acids, natural moisturizing factors in niacinamide, while water-retaining ingredients such as hyaluronic acid and panthenol will support our skin's ability to retain moisture. So, to restore barrier function, vitally important before doing any injection and laser. One more step before injection, it is improving microcirculation. Skin microcirculation is located in the dermis and hypodermis layers. It plays a significant role in skin homeostasis. So it means transportation of gases, nutrients, waste, and so on, and in inflammatory response. A microcirculation dysfunction due to external factors, for example, sun exposure, heat, cold, microorganism, or food, or internal factors, immune system, can cause redness, venous inefficiency, or even rosacea. Microcirculation hyperfunction might be associated with the accumulation of toxin and waste, excessive sebum, and might contribute to the development of seborrhea and acne. It also altered by skin aging with a progressive decrease of new blood vessel formation. Pure skin microcirculation might be also associated with accelerated aging of the skin and development of the wrinkles because gases and nutrients are poorly transported by dysfunctional dermal arterioles towards the skin. Following up the hypothesis of an dysfunctional microcirculation causes severe damage, and improvement of the skin microcirculation might be a useful tool in the maintenance of the healthy skin. Added to everything else, skin microcirculation can be improved with DMK enzyme therapy. To prepare the skin to injections, it is vivid to take small but important steps. In this stage, it is significant for us to focus on the following aspects of skin revision. The first is skin cleansing. To employ the product for cleansing, the skin must correspond to the functional characteristics of the epidermis. These are products that do not compromise the viability of the barrier function of the stratum corneum. The second is detoxification. It is an essential step in preparing for later injections. This step should not be neglected if your patient smokes and follows an unhealthy lifestyle. That is why I recommended using detoxifying agent such as potassium sulfide and kelp. Potassium sulfide is a vaporizing agent that converts impurities into gas. Kelp has a high content of vitamin A, B, C, E, and rich source of minerals and potassium. The next step includes the removal of hyperkeratosis, improvement of blood circulation, and lymphatic drainage function. I'll tell you more about this a little bit later. The cosmeceutical techniques to prepare the skin for injections include different peelings and enzyme therapy, which are crucial steps. Coming back to peeling, I would like to point out enzymatic peelings. Proteolytic enzymes, which are part of the enzyme peeling, weaken and adhesion and corneocytes due to destruction of the structural chemical bonds of the desmosomes and thereby facilitates the exfoliation of stratum corneum, and also directly break down keratin, skin protein. The effect of enzymatic peel does not extend beyond the stratum corneum of the epidermis, since the size and charge of enzymes prevent their further penetration into the skin. But due to the removal of the upper layer, the production of fibroblasts and the renewal of skin cells are stimulated. Proteases are most active at the pH of 5 to 5.5, so weakly acidic, and there are also antiproteases in the skin that affect the enzymes of the peeling composition, changing and suppressing their activity. So and bromelain, as you know, it's a enzymatic enzymes. Papaya is rich in antioxidants, helps to remove dead skin cells, has skin lightening properties, and bromelain helps to gently exfoliate the skin. And bromelain also had anti-inflammatory and antimicrobial benefits. Proteolytic enzymes of the epidermis participate in processes. You can see on the slide, it has differentiation and proliferation of keratinocytes, weakening of adhesion of corneocytes, regulation of water balance of the stratum corneum, activation of local enzymes, and taking into account all of the above stated, the usage of enzyme peeling is very useful before injections. And let's move to a signature DMK signature treatment, enzyme therapy. For many years, we have been using enzyme therapy to prepare the skin for injections, plastic surgery, and so on. I would like to continue with enzyme therapy, but let's stop for a minute to take a little detour. Due to discovery of enzymes and their employment in clinical cosmetology, numerous skin diseases and complications after invasive procedure can be healed. It is unique. It is this unique ability of enzymes that stimulate vital biochemical processes. Enzymes constitute a fundamentally different approach to skin treatment, utilizing the beneficial effects of transfer messenger enzymes. Enzymes are substances that work with certain compounds in the body to form a natural system of antioxidants, as you know. All biological processes, as you know, based upon the activities of enzymes. DMK enzyme treatment is a worldwide renowned solution for patients with skin issues. The signature skin revision treatment is designed to restore skin health and natural functions, amazingly rapid, and it is suitable for both men and women alike with different sensitive skin types and various skin-related deficiencies. To round it up, enzymes are responsible for multiple cellular processes. The enzyme therapy can treat many disorders and is therefore a multi-tool in a cosmeceutical therapy. Unlike many other approaches, the final goal of DMK enzyme treatment is not actually to get your skin look better on the surface. It is rather to improve its functions and health so that is better. Danné Montague-King uses so-called second messengers that report to small intracellular molecules. Second messengers, by the way, are molecules that really relay signals to some receptors of the cell surface to target molecules inside the cells. They are intended to activate intracellular signaling pathway and induce the cellular response. I would like to present another enzyme. It is superoxide dismutase. Superoxide dismutase is used as an anti-aging ingredient, an important antioxidant, due to its ability to reduce free radicals damage to the skin and prevent wrinkles, fine lines, and age spots. It also helps with wound healing, soften scar tissue, and last but not least, protect against UV rays. Numerous studies have reported an anti-inflammatory properties of superoxide dismutase. It prevents glycation processes and restores the barrier function of the stratum corneum. And final enzyme that I would like to refer to, it is a mitochondrial complex 2, which is also used in the professional treatments. Professor Mark Birchmartin presented his later research A protein in the mitochondria is called mitochondrial complex 2. It is a crucial component of the skin energy production. It is decreased aging processes in the deep layers of the skin. These experts said the mitochondrial complex 2 is a step towards successful pigment treatment. We can also do special treatments which include a copper chlorophyll complex in addition to second messengers. This complex stimulates the receptors of motor neurons and cell division processes. By the way, this ability is very useful before the injections of botulinum toxin. Taking into consideration everything said above, let me conclude. Enzymes have a regenerating effect thanks to their interactions with the skin. They lead to homeostasis, improve microcirculation, and lymphatic drainage. Topical enzyme therapy is very competitive and it has a huge potential in different skin disease treatment. Enzyme can be paired with acids or alkalines to improve the appearance of the skin effectively and help to alleviate a variety of conditions. And last but not least, I would like you to use enzyme therapy also for an enzymatic effect. It means lymph plus blood and specifically formulated enzymes increase circulation and increase lymph drainage action. The plasmatic effect promotes a rush of fresh new oxygenated blood from within the skin due to dilate capillaries. And so enzyme therapy dilate peripheral capillaries and hence the plasmatic effect. This slide demonstrates the plasmatic effect, or in other words, improvement of microcirculation. It gives us an opportunity to compare identical parts of the skin in real and the picture from Anatomy Atlas from Dr. Fabi in Galina. On the next slide, you can see various options of injections which we use in our practice every day. The good news is that enzyme therapy works well with all these injections. This combination provides great long-lasting result and follows to avoid complication. Before making injection, we should understand what the guarantee of the great result is the correct preparation of the skin before injections. I think many of you, including me, have noticed that it seems like there are no wrinkles on the face and skin. It looks smooth after the injections, but still the person's appearance is according to his age. But in order to achieve good results, you need to carry out preparatory work before injections. It is fact that over the years, the jelly-like substance that gives our skin turgor and radiance becomes thinner. The skin begins to atrophy and sag, becoming like chicken skin. Our skin cells suffer from a lack of essential amino acids, and due to hyperkeratosis, the skin looks dry and wrinkled. If a filler is injection into the epidermis, cells use it as a nutrient and matrix restorer. Instead of adding volume or smoothing the skin in certain area, the skin absorbs the ingredients like food, and the patient gets a very short-term result, unfortunately, but it's true. And only healthy skin will retain a well-formed fillers for several months. It is also very important to maintain the health of Langerhans cells in the epidermis, which are pre- and post injections. Imagine how the right enzyme therapy first removes dead cells, then fills the cells with fresh oxygen, and reverse osmosis flushed all toxins from the skin, and then triggers the fibroblast cells to produce new strong collagen. Clogged pores and unclogged hyperpigmentation dulls, and skin begins to look toner and radiant even before any type of injections, whether botulinum toxin or fillers or combination of both. If you don't use the injections, you can use enzyme therapy instead. As you have known from the video, enzyme therapy works with our skin in a proper way. It is an absolutely self-contained procedure. A little bit later, I will show you how DMK treatment is able to cure scars. I'm looking forward to share with you our great results. So, let's move to light-emitting diode therapy. This therapy is a popular non-invasive skin treatment for acne, sun damaged skin, aging, wound healing, and other skin problems. The treatment uses variety of wavelengths. This penetration may trigger biological processes that help the skin rejuvenate and heal. One of the main benefits of light-emitting diode therapy, it is safely record. According to research, light-emitting diode light therapy has an excellent safety profile. The treatment is also safe for all skin types and colors. Another very important advantage of lead therapy is that it works well with other skin treatments. So we combine it with enzyme therapy, and this combination potentiate each other actions, which lead to a more evident result. As you know, in aged photo-damaged skin, collagen synthesis is reduced, and using the variety of light-emitting diode therapy, it can trigger skin collagen synthesis. And in clinical studies, the increase in collagen production with concurrent MMP production has been seen in association with improved appearance of photo-damaged skin. Before I continue, I would like to say a few words about microdermabrasion. We use microdermabrasion very often in many skin conditions, especially in the scars treatment and age-related conditions and so on. And good news is that this method works very well with DMK enzyme therapy. So after cleansing the skin, we carry out microdermabrasion with corundum crystals and then apply DMK enzyme therapy. After enzyme therapy, we apply transdermal nutrition. And also I love combining the DMK treatments with the IPL, so-called intense pulse light, and we do DMK procedures between IPL session. So before and plastic surgery, the patient needs to go through several rounds of preparation, which helps to improve the quality of post-operating result. And actual cosmetic preparation begins at least 2 weeks before operation, although a period of at least 6 weeks is considered to be optimal. After thorough analysis of the condition of the skin, an individual plan is drawn up before preparating. Preparation for surgery always includes procedure aimed at improving skin nutrition. The key to good healing is excellent blood supply and good lymphatic drainage, as I mentioned before. In our practice, to prepare for plastic surgery, we use enzymatic therapy, enzyme and acid pills, and detoxifying of skin. The use of transdermal serums and creams with beta-glucans, vitamin C, panthenol, aloe vera, and so on. And now I would like to focus on transdermal serums, which contain following ingredients. First, my favorite beta-glucans are much more impressive than just another soothing ingredient. Many recent studies have even shown that beta-glucans have far more expressive than more mainstream ingredients, such as, for example, hyaluronic acid. Beta-glucans possess a broad spectrum of protective activities against adverse conditions and display important functions in the modulation of immunological and anti-inflammatory and wound healing responses. Beta-glucans are found not only to stimulate macrophages, which can speed the healing and broken skin of which can speed the healing of broken skin, but also inhibit growth of pathogenic bacteria. In addition, some beta-glucans also possess anti-infective properties and inhibits potential antibacterial activity against a broad spectrum of gram-positive or gram-negative bacteria. And for these reasons, beta-glucans are used in dressing wounds to stimulate the healing of the lesion and to prevent infections. The prevalence of beta-glucans or wound healing has also been tested in clinical and numerous clinical trials. And for instance, topical application improves healing of diabetic and venous ulcers. And magnesium ascorbyl phosphate is the most stable and preferred ascorbyl ester. This lipophilic molecule is easily absorbed into the skin. Magnesium ascorbyl phosphate has a hydrating effect on the skin and decreases transdermal water loss. It is also free radical scavenger that is photoprotective and increases collagen production under laboratory test conditions. Palmitoyl oligopeptide stimulates the synthesis of collagen and glycosaminoglycans of the dermis, increases the skin elasticity. Palmitoyl tetrapeptide 7 increases quality of collagen. It is primarily used in aging skin formulation to help support healthy collagen production and cell function. And now I would like to speak about supplements which are useful before and after surgery. Evening primrose and thibaxorn oil here. It has a long history of medical usage, and Native Americans, for example, use its leaves, roots to heal bruises, wounds, and other skin problems. Evening primrose oil contains hammalinolenic acid, which may help it improving the skin's epidermis. As a result, it smooths the skin and improves its elasticity, moisture, firmness, fatigue resistance. As per the study, linolenic acid is necessary for an ideal skin structure and function. Valuable substances which are contained in sea buckthorn oil play an important role in the proper functioning of the human body and gives the skin a beautiful and healthy appearance. A balanced composition consisting of fatty acid add to the number of vitamins in this oil and explains its frequent use in cosmeceutical products to take care of dry, flaky, or rapidly aging skin. Moreover, its unique unsaturated fatty acids and omega-7 and omega-6, omega-3 gives sea buckthorn oil skin regeneration and repair properties. Sea buckthorn oil also improves blood circulation, facilitate oxygenation of the skin, removes excess toxins from the body, and easily penetrates through the epidermis. Because inside the skin, the linolenic acid is converted to prostaglandins. Sea buckthorn oil protects against infection, prevents allergies, eliminates inflammation, and inhibits the aging process. With close to 200 properties, sea buckthorn oil is a valuable addition. People that have unusual skin with scarring may confront aesthetic, physical, social, and psychological consequences. A scar can be defined as a fault of blemish result from one former condition, wound or burn, for example. Scar formation is an inevitable consequence of wound healing, in which the normal skin is replaced by the fibrous tissue. So scarring is a natural part of the healing process after an injury. This scar tissue lacks the characteristic of the normal uninjured skin. And as you can see on this slide, as per International Advisory Panel of Scar Management, you can see the classification of scars. A scar that limit their mobility is functionally unfavorable, of course. And less than ideal scar may be the wide erythematosis and pigmented, raised or depressed, and some scars form is only this superficial epidermis layers, whereas other encompass deeper subdermal layers involving nerves and tendons. Active scars may manifest as firm, raised, reddish, and thick. Some scars are highly sensitive, and scar tissue may limit range of motion dependent of location. Often we have met with acne scar and post-operation scar. Atrophic scarring is often an unfortunate and permanent complication of acne vulgaris, as you know. And 50% of scar cases, there remain atrophic scar and vary in depth and size. It has a high prevalence, significant impact on quality of life, and therapeutic challenge for dermatologists as well. Therefore, many options are available for treatment of acne scarring, including chemical peelings, alkaline peeling, microdermabrasion, injections of collagen type 1, enzyme therapy, of course, and combined therapy. There is promising procedures such as enzyme therapy. So various modalities have been used to treat scars. In order to optimally treatment the patient's scar, we need to consider which treatment offers the most satisfactory result. Enzymes, acid, and alkaline pills, enzymes therapy are broadly used in acne scarring treatment. Scar improve with pills through damaging of the skin layers and cause rejuvenation, exfoliation, and remodeling tissue. Enzyme therapy due to second messenger and superoxide dismutase and so on helps improve metabolic process and microcirculation in scar tissue. Hypertrophic scarring is cosmetically displeasing result that is symptomatic of one healing disruption. Hypertrophic scars are defined and visible and elevated scars, as you know. When faced with patients seeking treatment for pathological scar, many physicians have difficulty in differentiation hypertrophic scar from keloids. Therefore, it's crucial to establish criteria to distinguish them. So, hypertrophic scar elevated more than 4 millimeters above the skin. Additionally, these scars do not extend beyond the general geographic margins of the wound and tends to regress over time. And hypertrophic scar primarily contain type 3 collagen oriented parallel to the epidermal surface and with abundant nodules and a large extracellular collagen filament. And looking for possibilities to improve the scar appearance, the patients seek for help from doctors of 3 specialties. The first, surgeons, second, dermatologists, and the last but not least, cosmetologist. Main goal of scar revision is to create an ideal scar, a scar revision procedure done of the scar to alter its appearance. The revision may improve the cosmetic appearance of the scar, restore function of the part of this body that may have been restricted by the scars, or improve and itchy scars. The ideal scar is narrow, flat, level with surrounded tissue, and difficult for the untrained eye to see due to color match and placement parallel to relaxed skin tension lines. But the final look of the scar depends on many factors, including the skin type and location of body, the direction of the wound healing, the type of injury, age of the person with the scar, and his or her nutritional status. It is important to explain our patients that the scar revision will improve but not erase the scar, and it may require multiple procedures, of course. It is important to remember that scars cannot be completely removed. And so, dear colleagues, I have come to the end of my report. I sincerely thank you for your attention, and the approach I have described are becoming more and more popular. I really hope that I was useful to you today. Thank you so much for your attention.
Thank you for Dr. Yuliya for the nice presentation, and thank you for Dr. Danné for your presentation in video too. And we go to a discussion session for 25 minutes. There are some questions for the speaker from Q&A column. Maybe a committee can help to present the question in a slide. And I want to read the question by one. For
Okay.
the first question is, can this enzyme therapy be used solo treatment only without continuing to injection? And what do you think of enzyme therapy in sensitive skin? Any modification for the layering? And it is safe when it used in pregnancy. Please, Dr. Yuliya.
Okay. So thank you for your question. The first question about enzyme therapy. I mean, like monotherapy. Of course, you can use enzyme therapy without injections because it's a self-contained procedure. And I'm aware that if you will do enzyme therapy once a week, you can achieve an amazing results. Thank you. And next question about sensitive skin and pregnancy.
Yes.
I'm aware that you can absolutely use enzyme therapy on sensitive skin and pregnancy time. For pregnant people, it's for pregnant women, it's a little bit tough question, because the woman is pregnant. We should follow her with a gynecologist, of course. I mean, if our pregnant women have a normal pregnancy without any pathological points, of course we can use enzyme therapy in an early stage of her pregnant. But it's complicated to have enzyme therapy when the woman pregnant in later stage of pregnancy, because he has a big stomach. And when we apply enzyme mask, the patient should be laid down on a treatment bed. But unfortunately, our pregnant women on the later studies can lie on her back, because the vein is pressed, and it's not contraindication, but it's a little bit difficult to lay down for our woman in a later stage of pregnancy.
Okay,
So
thank you, Dr. Yuliya. And the second question, maybe please.
yeah.
I would like to Dr. Yuliya, how do we know a substance has a good enzymatic properties, and how to maintain enzyme quality from denaturation, for example, and how to ensure a high stability during shelf life of final product to maintain active concentration and efficacy. Please, Doc.
I see. It's question about
The quality of enzyme.
how we know the substance or quality of enzyme.
Yeah.
For example, proteolytic enzyme, for example, bromelain and papain, it's well-known substances, and if you look through the articles in PubMed, for example, you can find a lot of articles, scientific articles that improve the good properties for skin. And of course, enzyme, for example, proteolytic enzyme, we should maintains of heat, because for example, bromelain and papain works in wet and hot environment. And as we can what concerning about enzyme therapy, superoxide dismutase, enzyme messengers, we apply DMK enzyme mask for 45 minutes, and because after 1 hour, these enzymes is denaturate. Danné Montague-King create this mixture of enzyme, and he's the first scientist in the world who provide second messages in cosmetology. Thank you.
Thank you, Dr. Yuliya. And the next question is from Dr. Amaranila Lalita. Dr. Yuliya, thank you for the information of the MK. I'd like to know whether the MK serum is compatible also for transepidermal delivery like LAAD and that create microchannels. Is it compatible with the heat that produced by the laser of RF? Thank you, Doc.
Thank you for your question.
Yeah.
We use DMK serums with ultrasound, for example, and for ultrasound, of course, you can use our DMK serums after lasers, of course. And I noticed when I work with lasers, after the procedure, I apply DMK beta-glucans. As you can my favorite serum is beta-glucans because it's a wonderful ingredients for wound healing, and so you can use, of course, these serums and laser of RF. I think this serum you can combine after laser or RF. So we perform RF or laser, and after procedure you can apply on a patient's skin DMK serums, of course. And I would like to notice that it would be a good result if you prescribe DMK serums after laser for home usage for our patient.
Dr. Yuliya, and the next question is for the patient on those cases. Did they accept the same pre-treatment before the procedure? Which treatment that given, the supplement only or in combination with the topical products? Please,
okay,
Doc.
thank you.
Yeah.
Thank you for your question. For the patient of those cases that we discussed, we did pre-treatment before and after, and pre-treatment and post-treatment after procedures, after, for example, after plastic surgery. Of course, we combined DMK topical treatment, and all our patient follows DMK home regimen. And from supplements, we used DMK-FI, which contains omega-3, 6, 7, 8, and thibaxorn oil and vitamin E. And the same. The question was if we have the same treatment. It depends on our patient's skin conditions. What topical products we choose.
Okay. Thank you.
Thank you.
Yeah. The next question is sorry. as the enzyme, about the enzyme therapy, Doc. About the enzyme therapy, the transfer messenger and protein biosensitizer have potential to increase the absorption of active ingredients enzyme 1 and 2.
I'm sorry, I didn't get.
Oh, okay. Yes.
Repeat, please.
Yeah, about the enzyme therapy, in the video of Dr. Danné King, she mentioned about the enzyme therapy. The transfer messenger and protein biosensitizer have a potential to increase absorption of active ingredients enzyme 1 and 2. Thank you.
According to studies, the transfer messengers works with our own enzymes that contains in our skins. And of course, transfer messengers includes on enzyme mask 1 and 2, and you know, a lot of in PubMed, a lot of articles that improve the good results and potential of these enzymes.
Okay, thank you, Doc. There are many questions in the question and answer columns. And the next question, Dr. Yuliya, do you have a result picture from treated Asia or Indonesian patient, Doc?
You mean in Asia skin?
Yeah,
you know, I think it's no problem to use topical enzyme therapy on Asia skin. And I'm sorry, I have personally, I have no experience treated Asian patient, because in Ukraine it's a very rare situation. But no, undoubtedly DMK is suitable for all types skin, because all color skin, because Danné Montague-King, and I'm so proud about this, he helped people in the early stage. He helped people with dark skin, with Asian skin, and it's not. It's completely true that you can use enzyme therapy on Asian skin, of course.
Yeah.
Thank you for.
Okay, thank you, Doc. And yeah, and is there any allergic reaction due to the enzyme treatment? The allergic reaction. Yeah.
Is there any allergic reaction?
Yeah, yeah.
You know, it's for me it's tough question, because I worked for 14 years with enzyme treatment, and in Ukraine we have 20 years of usage of enzyme therapy, and neither nor my colleagues have any allergic reaction. Thanks God, I have no any allergic reactions. But you know, it's before the usage of any treatment stuff, of course, as a doctor, we should explain our patient their feeling, and we should ask them about anamnesis before start the treatment, of course. But I have no allergic reaction. Thank you.
question is how is the efficacy of enzyme peeling compared with the conventional example? It's AHA and BHA and a TCA pill usually used in office procedure. Sorry,
Yeah.
the efficacy of enzyme peeling compared to conventional. Yeah.
I'm sorry. I lose my. I'm sorry. Could you?
Yes.
The question is about
The efficacy of enzyme peeling compared. Yeah.
compare. Yeah, I see.
Yeah.
Compare
With the
the
conventional peeling. Yeah.
office procedure. 1 minute.
Okay. Yeah.
All my professional years, I use alpha hydroxy acid and beta hydroxy acid.
Yeah.
And I never use TCA, and I can explain why. Because I'm sorry. I'm trust to alpha hydroxy acid because it's I can control all these ingredients because, for example, glycolic acid, as you know, it's a very small has small molecules, and the Danné Montague-King likes this acid because it potentiates, for example, other ingredients. For example, retinols, retinoids, and I'm for healthy skin, and I'm for safety skin, and I'm for safety procedure. Because with TCA, I never know what the result it would be. Because I think that I should go by little steps and be careful with our skin, I think.
Thank you for all of your answer. And I'm sorry because the limitation of the time, I must close the session. But for conclusion, from the Dr. Dan M. King, we have scientific refreshing about the homeostasis in skin and also revising this harmonious skin condition with a good skincare system with the concept of remove, rebuild, protect, maintain aims to match the individual biochemistry with the appropriate skin therapy. And from Dr. Yuliya, we learned about how this enzyme works in contributing to all medical procedure. Also, the preparation for surgery always include procedure aimed improving skin nutrition. And the key to good healing is excellent blood supply and good lymphatic drainage. And how to do uniquely DMK enzyme therapy for dermal treatment. Thanks again for two speakers, and let's give a big applause for our excellent speakers today. Many thanks for you, Dr. Yuliya and Dr. Dan M. King.